most of these insurance covers don't cover persons with disability because of our diversity. We have different needs. So the first time I tried the app was when I had some phantom pains, and I realized that I was able to book an appointment and meet a doctor. I had a conversation with the doctor, and he guided me on how to go with the phantom pain. For me, it's an achievement because sometimes when I want to go to an hospital for a phantom pain, I need to have some money for the consultation and everything. But with the app, I only asked Dr. Nick if I can see him, like through the app, if I can see him in his available hours. And he was like, yeah, you can just come, we will sort that with the app owners.
How have you been? Get onto the app and you'll see my available slots.
Okay.
So.
Yes.
Good. Are there any questions you have for me?
Yes, you get home early before it rains. Because if I get rained on, then I feel my prosthetic will get trapped.
Is there any other issue that you'd like to show? Okay. Can we go back? I have been using this application for about 2 years, and it has really changed the way I practice. I'm now able to put my available times on the application, and the patient on the other side is able to see the time. This has improved the time management such that the patient doesn't have to wait for too long, and now I am also able to earn through the app.
Snark is a platform that connects patients with doctors to narrow networks for diagnosis and treatments. Basically, patients log into the platform using the Android app, using their smartphone, or they can use a USSD if they don't have internet access to find a list of doctors and book appointments and consult them on the go. When the patient logs on our platform, he has two choices, either to take part of our data monetization program or just simply pay via M-Pesa, pay cash, and proceed to book a consultation. If they choose to be part of our data monetization, which again, our data is all anonymized, they will earn at least 33% or a third of the earnings from our data sale. That's how, over time, patients are empowered. They're getting money on their wallet, which they can afford to pay for the next doctor appointment. Whether they have insurance or not have insurance, they have an opportunity to have money in their wallet, which they can use to afford for the next consultation. Once it's anonymized, that means we'll never know what the encounter is only between the doctor and the patient, and we cannot trace back to which particular patient is diagnosed with what. Only we are picking out, the algorithm is only kicking out the information we are researching. So let's say a data customer is searching for specific things like malaria patterns happening in certain side of the country, then Snark Health is able to show all these analytics.
While working as a doctor, we experience patients struggling to meet the payment needs. So of course there is a need for innovations to address this challenge, and I think Snark Health puts us down that path. in a way that healthcare data can be monetized and thus used to offer these vital services. And I believe there's a lot of room of growth. There is, of course, always controversy of healthcare data, so it would have to be safeguarded, which Snark Health may be able to provide by using various technologies such as blockchain encryption, and also having an efficient way of storing this data and protecting it for every party involved.
Who will be able to walk you through the journey.
Through the app.
Yeah, so if there's anything you're going to...
I'm a bit okay, because I think whatever was bothering me has been kind of